webinar that is dedicated to health advice, longevity, supplementation, and we welcome all the patients that joined us today for this webinar that we call Periodont Tips, advice from your periodontists. And the panel is myself, Dr. Ziv Simon. I'm joined by Dr. Ari Rosenblatt, Dr. Lloyd Herman. We are the three periodontists here in Periodontal and Implant Specialists of Beverly Hills. And we are also joined by Jeannette von Johnsbach. Welcome, Jeannette. And welcome, Dr. Herman. Welcome, Dr. Ari Rosenblatt. You can turn on your camera now. And we are joined by many patients from our practice, current patients, past patients. And we're super excited to have all of you with us because this is a very important topic. What's more important than our health? Without our health, what else matters really? I think we all know the answer to that. So this is the purpose of the webinar today. We hope you enjoy it. I hope you benefit from it. And I hope that you can pick one or two tips from each of the speakers that can help you improve, even with a little bit of improvement every day, to live a better and healthier life. And us periodontists, we are technically surgical specialists, and a lot of the patients on this webinar have undergone certain procedures with us. But amongst all the 10, I think now 11 dental specialties there are in dentistry, the periodontist is the dental specialist that is the mostly related to the general health, whether it is because of treating gum disease or diagnosing cancer, different types of infections. And the mouth-body connection is something that we have an expertise in. And that's only part of what we wanted to share with you today. So again, welcome to our webinar. And I'm excited to have all of you here with us. So again, I'm welcoming Jeannette, Lloyd, and Ari. And we're excited to share some of our expertise with you. And we're also very grateful to have patients that trust us with their life, with their well-being. It's a privilege that we don't take for granted. So thank you very much for that. And we will deliver. We will not disappoint you. So as periodontists, like I mentioned before, our specialty is surgical. And amongst some of the things that we do are dental implants, treating periodontal disease, treating gum recession, diagnosing different malignant and benign lesions in the mouth, and dealing with the health of the mouth, because the mouth is a gateway to the body. So what you're seeing in terms of the patient experience when you come to our office, you're seeing the doctors typically in the operatory or in the OR, and a lot of you already visited our expanded and remodeled facility. We have like a mini hospital here in Beverly Hills, but we don't want it to look and feel like a hospital. We want it to feel more like not really a spa, but more a comfortable and reassuring place where you can get some of the problems handled. So you see us in the operatory, but there's a lot of things happening behind the scenes. Whether it is technology inside our technology center, or Ari, Lloyd, and myself discussing cases, brainstorming, and coming up with a solution to some of these issues. But the common thread is that it's all related to health, whether it's health from an infection point of view or the health of your smile, the health of your chewing and function. All of these things are very important. Hence, we're happy to be in business for 43 years. Not me personally. We have our founder, Dr. Rosenblatt, started the office in 1981. I joined 21 years ago. Dr. Herman joined us this year. So we're excited to continue that tradition in a larger capacity because we've grown over the years. So when we treat patients, we are looking not only into the technicality of the surgery, we're looking into our patients' as a whole. We are reviewing medical history, dental history, medications, blood tests, and other things that we're going to share in this webinar, because in dental school, they taught us that at the end of the tooth, there's a patient. And there's more than that. There's a human being, and the mouth is connected to the body in a very significant way, like you're going to see in the webinar today. But before we start talking about health, I wanted to welcome Dr. Lloyd Herman to our practice. He's been with us now for a few months. It's exciting to have Dr. Herman with us. He's a graduate of McGill University in Montreal. And as some of you know, I studied in Canada as well at the University of Toronto. And he then had a very successful private practice in Aspen, Colorado. And then he decided to become a periodontist after 20 years. So he's been in practice over 30 years. He's not a spring chicken, although he looks very young. And we're excited to have a specialist that has the technical skills and does excellent work and is very much appreciated by our patients here already, and is getting quite busy in the days that he's with us. But he is also doing things a tiny bit different, maybe with a little bit of a twist of holistic periodontics, which we're going to hear about here. And we feel like the addition of Dr. Herman is going to benefit not just us as a practice, but also our many patients and the many patients to come that can benefit from his approach. So we're excited to have him with us. But when I met Dr. Herman about 8 years ago, it just was not relevant back then. But 8 years later, we had a great opportunity to have him join. One of my conditions to have him join the office was that he has to be in shape. So I took him on a hike to the Calabasas stairs, and you can see them right here. And I challenge everybody on this watching this webinar, please go to the Calabasas stair, just look him up and do one. It's very hard to do. And I think that day we did like 5 or 6, I don't remember, but he passed the test and then he got the job. So he came with his 2 dogs and I took my 2 kids, and he proved that he's in shape. And hence, he can join Dr. Rosenblatt. As we all know, Dr. Rosenblatt is an avid athlete with marathons and Pilates and yoga and water exercise, and the guy's a machine. And we needed somebody who has the stamina as well, because to be a doctor is very hard, not just psychologically, physically. Hours of surgery, lots of what we call stress, if we let it affect us. And he proved that he has the stamina. So we're excited to have him with us, and he's already part of our practice. Not in full capacity yet, but we hopefully will have him for more days in the future. So we are going to deliver in a short and concise way, in a way that creates value and with conviction, because we don't do this for money. I mean, our profession is a true, true passion, and really what we put our life into, and we just love what we do. So we want to deliver that value, not just in the office, but also after hours, where we can deliver some of those health advice from the periodontist and also from a wellness expert like Jeannette. And each speaker will have about 10 minutes, don't catch me on that minute, but about 10 minutes to deliver some points. Interestingly, I'm just looking at the panel here. It's kind of an international panel. I was born in Germany and grew up in Israel and trained in Canada, and then ended up in the United States. Ari had a very similar background, born in Germany, grew up in Israel, went back to Germany, trained in the United States at at Tufts, pardon me. Sorry, Ari. And then moved to Beverly Hills. Lloyd, also interesting, from Canada, moved here to the United States, Colorado, and then Beverly Hills. And then Jeannette and we'll hear a little bit more from her, from Germany, from actually the same place where homeopathy was invented or discovered. So that's exciting. So there's some history there. And in terms of languages, we speak multiple languages here. So you can just guess which ones. So a healthy mouth will keep you healthy. There's no question that the health in your mouth is related to your general health. It's a port of entry into the body, whether it's different pathogens. If you don't have a full set of teeth, you're not masticating your food properly, so the food is not properly digested. And there are a lot of things that happen also vice versa. If you have diabetes or you have acid reflux, it's going to affect your dental health. So the mouth and the body are strongly connected, not just anatomically. The well-being of a human being depends on both systems functioning really, really well. Plus, we want to have a beautiful smile. Why not? Why not be able to smile with a full set of teeth and with confidence, and a healthy smile also has to do with it. So inside your mouth, in order to have a healthy mouth, we need to know what's inside the mouth. We have different microorganisms. We have bacteria, viruses or viri, and fungi. Luckily, they normally live in harmony unless something goes wrong, and I'm going to talk about that as well. And it's very important to be in tune with your body, I believe so, and with your mouth. And when you feel something is happening in your mouth and you feel any type of swelling on the gum, whether it is closer to the teeth or far away from the teeth, typically you're dealing with a bacterial infection. Oral bacteria invade a space and create that infection. It's not necessarily a gum infection. It could be a root canal infection, but typically it comes from bacteria. So pay attention. Anytime you have any pain on the gum tissue, typically you're dealing with bacteria. And if it's bacteria, we have a pretty good course of action for that. And I'm going to talk about some of the treatments. Viruses are tricky little creatures. They utilize our own cells to create harm for some viruses that I'm going to mention to you. And they too can appear on the gum tissue in different spots. They can also appear on the lips, and that's a different type of virus. I'm not going to get too much into that. One is more of we call it the HPV virus. I'm going to talk specifically about this one, which is very important to know. It has a very serious health implication. And the one on the lips is more from the herpes family. So not to get too technical or too medical, but just to know when you have something on the lips, it's typically viral. If you have some swelling on the gum and pain on the gum, it's typically bacterial. If you have something on the gum and it's not painful, it's typically a virus. Okay. Now, fungi, specifically Candida, or we call it oral thrush, typically appears on the tongue. It appears on other places as well, like the cheek, floor of the mouth, the throat, the soft palate. But in the tongue, it will appear more often than not, usually after a patient has been taking systemic antibiotics. It's a common side effect. But also when the immune system is off, because fungi are opportunistic microorganisms. So when something goes wrong with the immune system, they raise their ugly head or their white head because they look kind of ugly and white. Luckily, usually those microorganisms live in harmony. And my message here at this point is we all have bacteria, viruses, and fungi living in our mouth all the time at this moment. Us, animals, everybody's got them. Babies developing in the womb don't have anything. But as they come into the world, they acquire those microorganisms. So when we see a problem with an infection of one of those three, it's because something's off. Either the immune system, nutrition, something systemic is going on. There was an infection from some source, and then you need to involve a dental specialist, and we have the expertise in that. So pay attention to any abnormality. Don't wait for your cleaning time in 3 months or whenever that is scheduled to speak to the dental professional. Call the office, call your dentist, and get this checked out. Worst case scenario, it's nothing. But if it is something, it needs to be treated. Because if something's happening, like we're seeing here, swollen gums, well, that could be a side effect of medication. It could be a bacterial infection. There are a lot of things that we can diagnose, but we will typically see bacteria invading the gum tissue, and that's our expertise. And that in itself provokes the immune system to cause a response. The bleeding and the swelling, that's not the bacteria bleeding away. That's our own body getting inflamed and telling us, hey, there's something wrong. And that's why a dental expert is very important. So one of the things that we do on regular basis is we take a sample of your saliva. So we literally ask you to spit at us, take a small sample, send it to a lab, and we get the DNA sequence of the bacteria that potentially has caused the infection. And we get a very detailed report. A lot of our patients had that test done. We don't recommend it just as a screening, but if there is an actual infection problem, that's one of the diagnostic tools that we have in the office. And it allows us to identify in an irrefutable way what's the bacterial composition in the mouth. But what do we do? In a nutshell, we examine you, we do some imaging, whether it's 2-dimensional or 3-dimensional. We have our CT scanner here, and we get to a diagnosis. And it's something every dental specialist should be able to do in a short period of time, and we will accommodate you for that. And then if there's a bacterial infection, typically we do some type of a deep cleaning. We apply an antiseptic. We would recommend a possible minor procedure if needed to. So we have very good solutions for bacterial infections, and sometimes for some patients, antibiotics are needed. If we can prevent the problem from happening, that's way better. So bacterial infections are typically prevented by regular cleanings every 3 months in the office, good oral hygiene with brushing, flossing. We like the electric toothbrush, and the closest rinse, which is the formulated sodium hypochlorite, which is technically bleach, and that helps against those types of bacteria. And of course, a follow-up is always very important. And a new thing that came to the market, because not everybody likes to spend hours flossing and brushing, we came across a new technology called Proclaim. And the claim of Proclaim is that you can brush and floss or replace brushing and flossing with this machine. I certainly don't believe this is the solution for everybody, and we're testing it out right now. But what it is, it's a machine or a technology that is customized to your mouth. And it doesn't mean that everybody needs to get it right now, although we got it for ourselves for testing purposes. And the way it works, it creates a power wash in your mouth. It lasts about 6-7 seconds. We first take an optical scan, a mold of your mouth with our optical scanner. And then we make that custom mouthpiece for you. And that connects to that machine. And when that machine creates that high pressurized water, it goes through the machine, through the cables, into the trays, and just gives you just a great cleaning. And I see a very good potential here for patients that don't have good oral hygiene or have some dexterity problems or a little bit on the older side or are dealing with cognitive issues or patients that have some type of mental disability that don't exercise good oral hygiene. It's not a replacement for brushing and flossing, but it certainly gives you a really good head start according to our first testing here in the office. So when the time comes, we'll be able to provide this to our patients when indicated. Let's quickly discuss the fungal infections. Like I mentioned, they're opportunistic and they're on the tongue after taking antibiotics if the immune system is off. So anytime we see an immune imbalance for different reasons, we are going to see some candida. And candida is very, very clear. We can diagnose it just by looking at it. You can look at your own tongue, as opposed to what your mom told you, don't stick your tongue out. Stick your tongue out in front of the mirror, in front of your spouse. You want to see a pink tongue. It needs to be pink. It shouldn't be black or brown or white. And if there's a white coat, and that coat can come off with a piece of gauze or with a tongue cleaner, then it's probably candida. And that too has treatment, but it needs to be diagnosed first. And the first diagnosis is at home, and we do the saliva testing for candida as well. Besides having an opportunistic infection in the mouth, the tongue is also a source for bad breath, as we call it halitosis. Most of the problems with bad breath, as opposed to common belief, don't come from the food that you eat. Even if you love garlic and onions, that's fine. That's part of every cuisine. And it just evaporates after a day or so. But it comes from the back part of your tongue. So a problem with bad breath is usually treated with a tongue cleaner. You just have to go deep enough to the back of the tongue where you feel slight gagging, and that's going to help with bad breath. And if not, there are other reasons. It's not coming from the stomach. It's not coming from the sinuses. It's not reflux. It's usually not coming from, in between the teeth unless there's an infection. And that's just a very simple solution that kills two birds with one stone. One is the bad breath and one is the candida. The other thing candida doesn't like is to be depleted of sugar. So if you minimize sugar in your diet, you can not give the fungus the building block for its existence, and that is minimizing or changing your diet to be more sugar sensitive. Viruses are tricky. Viruses are tricky not just because of their size. It's because they're using your own cells to create harm, depending on the type of virus. And the one that I'm just going to mention very briefly is the HPV virus. And the human papilloma virus, females, get a pap smear to check for that particular virus because that virus creates lesions. In the mouth, it creates lesions on the gums, and they look kind of white and irregular. So if you're looking at your teeth, you're looking at your gums, you see something white, it needs to be checked because it could be an HPV type of lesion. Lesion doesn't mean cancer. It means that this is a viral infection. You can see it right here. And the solution is very simple. We take it off and we biopsy it. We find out what it is, because if it's left to be, it can actually, with time, it can transform into a squamous cell carcinoma, which is a type of cancer. So the first step is to be aware of it, have your dentist or the dental specialist look at it, and we simply take it out. It doesn't belong in the mouth. We biopsy it, and we get a diagnosis. If it's HPV, you can sleep at night. We will take some other tests, such as an oral test for the virus, for the HPV. And why is that important? Because we found it on a lesion. We want to know if there are other viruses in the saliva. And there are different types of HPV, and there are some types are more dangerous for malignant transformation. And again, if you had HPV, it's not the end of the world. It can be biopsied. It's not something that you need to worry about, as long as it's diagnosed and as long as you do the saliva tests for it. Now, we have another tool. We don't biopsy every lesion in the mouth. We have a tool called the Velscope, which is a source of light. And that light, we shine on the lesion. We shine it actually in the whole mouth. And it sends a certain wavelength to the cells in the mouth. And the cells respond with their own wavelength that is different. And we can capture that wavelength inside a camera. And if it doesn't respond properly, then there's a suspicion for either malignancy or some type of abnormality. And this is what it looks like. It looks green. So the picture of the actual tongue is on the left, and the picture from that cancer screening light is on the right. It looks green. And we can find different abnormalities, which I'm not going to get into it too much right now, but we can see different abnormalities without even taking a biopsy. And it helps in the diagnosis and deciding what to do next. So we have that technology available. And together with the different saliva tests for bacteria, viruses, and fungi, and the oral screening plus the light screening for cancer, we can determine what type of microorganisms are in the mouth, what lesions are suspicious, what needs to be biopsied and what not. And for everybody to have a peace of mind, if you tested positive, it's not the end of the world, and there's treatment for that, because a lot of those microorganisms live together in harmony like we all should live. Personally, from a health perspective, I wanted to share that for my own health, and we're going to try and share it here as a theme for our webinar here. Personally, changes in my own health came from not skipping breakfast and not having my morning coffee. Gave me some great impact on my own health. And as much as I love working out for my whole life, As I entered into my 50s, I made a decision after educating myself that I don't need to work out in very high intensity because of injuries. So I reduced the intensity of my workouts and maybe more frequency. I don't know if you can do it more than once a week, once a day, but I'm able to do more and living better. And these are the 4 books that influenced some of my health habits. One of them is called The Glucose Revolution, about glucose spikes and insulin. One is about sleep, why we sleep. We might have recommended it in one of our previous webinars. How Not to Die, very good book, a bit too scientific, but it tells you what not to do, very important. Also, probably important to read the book How to Live, but that's a separate story. And Super Gut, about the microbiome. Ari, the floor is yours.
Hello, everyone. Many of you remember when we reached out to you with our first Zoom lecture when COVID happened and all of us were concerned about not getting sick and how to make your visits to our office safe and comfortable. At that time, we shared our precaution in our office using protective measurements, for example, air filters, protective equipment, and supplements to improve our immunity. Now, we are building on that experience and we are sharing with you new insights and validated new medical research how to stay healthy and improve your immunity, especially if you are scheduled at our office for procedures. Today, the buzzword in preventive medicine is to reduce oxidative stress. For example, diabetics and smokers are in oxidative stress. What is oxidative stress? When molecules called free radicals in the body are present and not enough antioxidants are present to get rid of them. So let me share with you how we can improve our immunity within our control and not only stay healthy, but improve our outcome of procedures and prevent infections. When we perform surgical procedures in our office, we rely on many factors to improve the outcome. For example, using stem cells, and the success is really, at the end, the patient's immunity. So in our first lecture, as you can see here on the first slide, we reached out and informed you about the best products to use in order to reduce the chance to get COVID and improve your immunity. And we suggested the use of those supplements and products. Luckily, the crisis of COVID seems to be over, but I must share with you that I'm still using some of those products, especially the Betadine products, when I'm on a plane or exposed to lots of people in a closed environment. And for me, it's not about COVID anymore, but reducing any exposure to viruses, bacteria, and improve my immunity. So let's get into specifics. And all of you know that it's important and beneficial to control our cholesterol levels for our overall health. It is known that HDL is an antioxidant and the LDA is an oxidant. New medical research is showing that a high LDL is not only bad for your heart and blood vessels, but now new research is coming out that it's actually also bad for immunity and the healing of any surgical procedures. So we want you to be aware about this and discuss your HDL levels with your physician. On the next slides, you will see that everybody is aware about the importance of vitamin D, and most of us are deficient of vitamin D because we are afraid to be in the sun and wear sunscreens. But please be aware that vitamin D intake is much more improved when combined with vitamin K, and that the intake is dramatically increased. And as you can see, both of those vitamins protect against oxidative stress. And for us in dentistry, when we remove teeth and place implants, it's important for bone formation and helps with the healing. So on the next slide, we actually, all of us know about the importance of vitamin C, and all of us take it for flu and when we get sick. But again, new research is showing that vitamin C is not only important for the flu or getting a cold, but it's a very powerful antioxidant and helps connective tissue healing, in our example, with healing of the gums, and is a very powerful reducement for inflammation in inflammatory disease and improves the bone remodeling and bone healing. So, as you can see, we are mentioning a lot of vitamins that are common knowledge, but my point and our point tonight is to make sure that you understand that new medical research is really showing that all those vitamins that we are mentioning are actually also improving healing and make you a better patient for procedures. So on the next slide, this may come as a surprise to you. Everybody knows that sleep is very important, and medical research is more and more showing it that sleep is very important, besides, as Ziv mentioned, exercise and other things. But for those people who need any kind of either supplement or medication to help them with sleep, or what is now being recommended for surgical procedures, there is a benefit to actually take melatonin, which is not a medical drug and doesn't have all the side effects. And research is showing that it has, on the most small doses of 2 milligrams, a very strong anti-inflammation action, and also is antimicrobial and improves the immune functions. So besides getting a good night's sleep without side effects of any drugs or whatever, we will start recommending our patient to start taking it a week before and a week after surgery because of that particular benefit. More supplements to mention that are usually in multivitamins, as the next slide will show, zinc, are very important. And I'll mention a few other ones. We know about zinc that a lot of people, including me, who are supposed to be called elderly, are deficient of zinc. So again, before surgery, we will start recommending all those supplements and increase them because they are very important for the healing, especially as you can see here, there is medical research showing that after removing teeth, it accelerates the rate of formation of bone, and it actually also increased the healing for infection and prevents delay of wound healing. On the additional slides, everybody knows or believes that probiotics may be helpful. Most physicians may discount the benefit of it or whatever. But again, I'm sharing you new research from Europe that besides all the benefits that probiotics can be beneficial for your gut and well healing, that it actually benefits your immunity. It reduces inflammation, and particularly with us, it protects the effects of bone loss. And when we do surgery, it will increase the healing. On the next slide, you will see that some other obvious vitamins that are there and now being shown, besides the regular health benefits, that they are protective in the mouth with bone protection and anti-inflammatory effects. And especially on diabetic patients, they reduce the oxidative damages. Copper is very important. I'll mention a few more, and please excuse us that we use some samples just down from the internet. We are not endorsing any particular products, but we want to make sure that you understand that we will start recommending and summarizing those supplements to our patient before and after procedures. So if Ziv can just advance the next few slides, copper, magnesium, and what follows after magnesium is also omega-3, are all beneficial for our general health, but have been shown again recently, especially in Europe, that they have very strong anti-inflammatory agents and help especially with surgery in the mouth. The fasting is a new buzzword and has not only been shown beneficial for weight control, but there is now new evidence that it also improves our immunity. When cells are fasting, they actually organize their own cleaning and eliminate all unwanted substances. And basically, fasting is as a physiological detox process. For us, we will start again recommending to our patients to just have an early meal at night, forget about breakfast, and then start with a healthy lunch and dinner. And it has been shown that if one does it a week before and a week after surgery, that this will improve the immune system. And all of this is credit to the Nobel Prize winner, Oshisomi, who invented that particular and published that particular principle of intermittent fasting. So after reviewing all of it, this came all when we discussed how to improve the immunity, how to improve our surgical procedures with one of our colleagues and mentor in Europe, who is not only a great doctor, but actually also a smart businessman. He took it upon himself to produce one pill that contains all of the above mentioned supplements and combine them all and give this to his patients 1 week before and 1 week after the surgery. So as soon as we heard about it, we tried to buy it for our patient, but found out that it's actually sold out and back ordered for more than 3 to 6 months, which proves how successful that philosophy is in Europe. So I decided to go on the internet and purchase all of them separately, and hopefully some entrepreneur will produce it in the United States in one pill soon. And again, forget about the product names or whatever. They are available in many different functions. But that basically what you see here combines the one pill. And hopefully in the market, somebody will come out with one pill together. But when you look at the next slide, I don't think you need to go overboard as I do. When you see this supplement collection in my kitchen, this is only one aspect of my philosophy to stay healthy. Many of you know me over the years that I pride myself to stay in shape, having run marathons, still walking, jogging, doing Pilates and meditation in order to continue to stay healthy and practice for the last 40 and more years. I hope this short summary will help you to improve your health and immunity. And for the record, please review any new medication and supplements with your MD, since we can't give you any medical advice. But we only share what has been discussed and published in the medical literature recently. And it's my pleasure now to give the podium back to Ziv, who will introduce you now to the next subject matter, and Dr. Lloyd Herman.
Thank you, Ari. What a great summary on supplementation and how to live healthy. And you're certainly an example of a doctor and a person that practices what he preaches and is living healthy, and you look very healthy, knock on wood. So you're looking great and doing great surgeries as well. So thank you, Ari. So next, we're going to hear from Dr. Lloyd Herman, who joined our practice, and we're excited that we now have another angle in periodontics. So Dr. Lloyd is trained in the same procedures that we do and we have been doing for many years, but he has his own twist.
Well, thank you so much, Ziv. Hello, everyone. I feel so privileged to be here. Thank you for attending this webinar. Being part of the team is great. I'm just really enjoying every day being with Ziv and Harry. So one of the things that I bring to the office is my holistic approach to dentistry, to life. I think both of them are kind of on that page. So I think we all work well together. So to give you a little bit about me, I think Ziv gave a little bit. I practiced for 20 years or so in the mountains of Colorado. My two favorite ski places, Steamboat Springs and Aspen, Colorado. So I feel very privileged to have lived in those towns. I was a general dentist at that time and then went back to school to specialize in perio. So it's really good to be in Beverly Hills and to be working with this great team. And so just to give you a little bit about what I look at as holistic practice, basically I take, first of all, everybody that's coming into the chair, they have a little bit of anxiety too. They're having a surgery done or a big procedure. And so I look at how do I bring that stress response down a notch. So some of the things that I do are breath work. I work with essential oils to help calm the nervous system, and also even using sound therapy. So with that, I will move on to a little bit about talking about, how the human body can heal itself. So we definitely want to enhance that in our procedures. We want our patients to have the optimum healing. So some of the things, we might only be tapping into a very small percentage of what our body has, potential to do. So our body has built-in remedies, right? We have our immune cells, which act like antibiotics. They protect us, the B cells, the T cells, antibodies. We have endogenous cortisols, which act as anti-inflammatories. Even dopamine and serotonin can act as antidepressants. And our body has an unlimited amount of skeletal calcium. So that's sometimes where we'll draw some of the calcium that we need in our body. And even the cells will have peroxide that will help protect and kill viruses and bacteria. So basically, we're dealing with regeneration in our practice. And, this can show how we can actually regenerate bone on these teeth. Many of our organs, we have potential that is beyond our belief, that even our liver can regenerate itself over time to a point. So how can we tap into the greatest potential of this healing power? So at our office, we use PRF, which is platelet-rich plasma. So what we do is we're going to do a blood draw, just like you'd have at your physician, and take that blood, and we'll use it for its healing power. So we spin it in a centrifuge. Here we can see the centrifuge, and then it's basically spun, and the cells that are the useful ones are at the top of the test tube, and basically those are in that, with those arrows, that's the yellowish liquid, and that's the PRF that we're looking to use. So what do we do with this PRF? We can add it to bone graft material. Basically what it does is it can make it more active with your cells. Basically, PRF will have your immune cells, it'll have fibrin in it, platelets, and circulating stem cells. So this is all added to, let's say, our bone graft. And so we call it sticky bone because basically it helps the particles of the graft material to stick together. We also can use that PRF in order to add to our soft tissue procedures. Basically, our soft tissue heals faster with the PRF. So just as I said, we use it in gum procedures, extractions, bone grafting, sinus procedures, gum recession treatment. And so PRF, what does it do? So it stimulates tissue regeneration. It enhances wound healing. It reduces inflammation, and it improves bone regeneration, and also even reduces the risk of infection. So we use, other things in our practice to help enhance healing. And one of them is ozone. So most people know it by the ozone layer, and, that we're worried about that the ozone is getting depleted because of all these chemicals that we use in aerosol sprays and our refrigerants. And so that's what we're usually looking at, is the ozone hole. So what is the effect of ozone, and how do we use it? So basically, oxygen would be at O2. So you basically have two oxygen molecules, and ozone adds an extra oxygen. So basically that will help to react with different components, and it'll help to kill viruses and bacteria. So, kills bacteria, viruses, fungi, and it also helps to stimulate the body's natural healing process. So these are some of the benefits that we get from ozone therapy. I'm not going to go into it, all those things, because kind of went over that. And so this is what we actually have in our office as a unit. So basically what this does is it's an ozone generator. It will take oxygen from our oxygen bottles, and it'll convert it to ozone. So this is not going to solve the ozone problem in the atmosphere, but we can take our ozone pen basically and spread the ozone gas into the area that we're looking to enhance. So what do we use it for? I'll use it for disinfection during extraction sites. So it kills all the stuff that we don't want. It also enhances the blood flow to that area. It stimulates bone growth and enhances healing. So not only are we using ozone, but there are other treatments that are like in the medical realm. And basically what is done is the blood is taken out of your arm and it's ozonated, and then it's pumped back into your arm. And this will help to hyperoxygenate your blood and really help in healing and a lot of other things. But that's not part of what we're going to go into here. But this leads into another aspect of one of the things that I'm very into is IV therapy. So I know there's times where I've been traveling a lot, or I feel like I'm getting run down or sick, and there's different IV combinations or cocktails. One of them is called a Myers cocktail, and I find that when I'm feeling that way, it is an amazing way to improve my energy levels, build my immune system, and I just feel so much better after having it. So what is a Myers cocktail? So basically what it will contain in it is magnesium, calcium, B vitamins, vitamin C, depending on the combination. You might have glutathione, which helps support the liver. You'll have some trace minerals like zinc. And so all these things help to really boost, just like Ari was talking about with all the vitamins, it helps to boost your whole system. It gives you like, you're made into Superman or Superwoman. And so one of the things that sometimes happens in our bodies is because our gut is not necessarily healthy and absorbing all the things that it needs to absorb, we might be deficient in some of our vitamins and minerals. And so this is a good way to really boost you up. I find that patients that use it like a day before a surgery, the day of surgery, and the day after surgery, they recover a lot faster and they feel a lot better. So I highly recommend this. So how to improve your health. So remember to take your meds. So what does that stand for? So basically, mind and meditation. So with mind and meditation, your thoughts are what create your reality. So you have to be careful of what you're thinking about. So if you're thinking about negative stuff and worry and all that stuff, it puts you into a space of, where you're forming all these chemicals in your body that don't allow healing, and they break stuff down. And so really you want to try and have a positive outlook, be grateful for things, and really keep consciousness of how you're thinking in your mind. There's also exercise. So why do we need exercise? We need to pump our blood through our blood vessels, and that helps to get the lymph going. That helps to circulate all the nutrients, and also helps with healing, because basically getting blood flow to the surgical sites helps get oxygen there, and that helps healing. So diet. I'm a big proponent of organic foods, and eating well, and making sure that you're getting a complete diet. And another thing that you tapped on, both you, Ziv, and Ari, about the fasting. So that's something to also incorporate. And then again, sleep. I think sleep is one of those things where that's the time when your body just has time to regenerate. It has time to get rid of the toxins from your body, and a lot of your hormones are formed in that time when you're sleeping. So before we go on to the next thing, I want to thank you very much for all being here, and thank you to Ziv and Ari, and on to our next speaker.
Thank you, Dr. Herman. This was great. And we all want to remember to take our meds. Our next speaker is Jeannette von Johnsbach. And she is a wellness expert. And through some mutual patients that have been treated in our practice, we made an acquaintance. It so happened that we were both born in Germany, ended up in Beverly Hills or Los Angeles. And we're excited to hear about Jeannette's expertise in general, about homeopathy, and also about certain recommendations. Listen up. Jeannette, the floor is yours.
Thank you so much, Ziv. It's such a pleasure to be here with you. And my passion is really helping people heal themselves. And in my practice, I use different integrative strategies like homeopathy, nutrition, energetic healing. And today we want to focus a little bit on homeopathy, of what you can do when you have to go through a surgical procedure. And what we're really helping your body do is to tap into the resources, its innate healing mechanisms that are incredible. Your body is the most incredible instrument that has been given to you, and life is flowing through you. And this life has all the information that your body needs to self-heal, to repair, and to protect itself. And sometimes the self-healing mechanism can be a little slowed down because of interferences. So there are many things that we can aid and activate your innate self-healing capabilities. So it's not a medical advice or medical treatment. It's really helping your body to do what it naturally is designed to do. And it knows how to do things and in which order. And so how we can support this, let's take a look. Today we talk about pre- and post-surgery support. And so first I'd like to explain a little bit what homeopathy really is, because it's a very unique modality. And then we will talk about some remedies that are often indicated during those procedures, and how you can support yourself before you go to the appointment and may struggle with being nervous about it, and then also some nutritional considerations that help recovery. So homeopathy has been around for a couple hundred years and was first proposed by German physician Samuel Hahnemann. And I was exposed to homeopathy early in my life, growing up in Germany, and it always had a very dear place in my heart because it is a very unique system that can really stimulate your own healing mechanism in a way and help reverse situations or process through situations very quickly. So to help understand the principles of homeopathy, I'd like to ask you a question. What happens when you cut onions? Usually people might experience tearing eyes or runny nose. So in homeopathy, the idea is if you make a homeopathic preparation out of that substance that causes those symptoms in a healthy person, and then expose that person that experiences those symptoms, that it signals to the self-healing power of the person, its vital force, its innate intelligence, what it needs to do. And that is really the most fundamental principle of homeopathy, of finding the similar substance that creates that. So what happens when you get stung by a bee? Homeopathy can use substances from all kinds of matters: plants, animal kingdom, minerals. And what it does is it tries and it needs to create a picture that shows the body what is happening. It shows the vital vitality, a picture. So when you get stung by a bee, often people experience swelling, it's warm, and also cold application make it feel better. So what homeopathy is doing is taking a little bit of this bee and potentizing it. It's basically diluting that original substance into very, very minute molecules are present. And in the higher dilutions, there is no molecule present because it is just about the energetic information, the picture that is a symptom presentation. So those little globuli here, this is just a carrier of the actual information. A homeopathic remedy is either globules like this or ointments. And what it does is it shows the innate intelligence of the body a picture. So the body has the physical, the mental, the emotional expressions. And when a person expresses characteristics on all those levels, and this specific picture then is the same picture as the remedy, the body gets a very clear signal of what to do with that. So in order for homeopathy to work best, one has to find what remedy is matching that symptom picture. And the dilution is creating a clear picture for the situation. So it's almost like you zooming in with your camera to make sure that for the specific situation of a person, that picture is very, very clear to its innate healing power. And if it's also giving it the appropriate time and potency, the body has the ability to really tap in all its resources and speed up the process of what it would normally do. And it's also important to understand that homeopathy is not herbalism. Sometimes people think it's the same thing because a lot of those remedies are made of plants, as we will see in a bit. But herbalism relies on a response to a very specific amount of substance, of phytochemicals, of actual compounds. And homeopathy is really showing a pattern, an energetic pattern and information. So herbalism, like supplements, have to be carefully selected before and after surgery because they can interact with the drugs that are needed for the surgery, like anesthesia. Homeopathy doesn't have this problem because it literally just gives the information to the vital force to do its natural processes really fast without interference. So it's really complementary. Some of you might have heard of arnica. Arnica is this yellow flower there, and it's an herb that has been used for bruises and swellings. And the beautiful thing about homeopathy is that substances that are sometimes even toxic in its original form then can be used as a homeopathic preparation because it doesn't have the molecules in it. It's just a picture and an energetic information. So arnica is the #1 remedy in homeopathy that is used for physical injury in an acute situation. So let's say somebody is falling, or if you have surgery, there is a physical impact on the body. And this remedy not only helps the body to heal faster from the impact and dealing with bruising, swelling, muscle soreness, it also takes the shock that comes from the impact. So it doesn't suppress any function like inflammation. It processes it faster. So that's why with homeopathy, there's often a shortening of inflammation or inflammatory processes because the body is speeding up, accelerating this process of how to respond to the situation. And so in this specific case that I was working with somebody who was undergoing major mouth reconstruction, it made sense to use a specific potency that was a little bit higher because it matches that impact, that strong impact, and to give it before the surgery once, and it signals to the body, to the vital force, hey, get prepared. So it's kind of not surprised when the impact happens. And then right after, it's not interfering with any pharmaceutical or substances that are given. It just gives the body another signal to the vital force to release any shock that might have come to its innate system from the surgery, from the procedure, and then really accelerate the processes the body is going through while it's healing the tissues. Hypericum is another remedy often used in homeopathy, especially when it comes to dental situations. It's the #1 nerve injury remedy one was thinking of, and especially when there are shooting pains, sharp pains, very sensitive to touch. So any nerve-rich tissue that is affected will benefit from that. If you have this in your home pharmacy, it's a great remedy. If the fingers get caught between the door or the windows, it's something that is very, very beneficial to help, again, that shock that the body has when there are impacts like that. Another remedy is ruta. And it's a flower. It has a very special affinity to injury. So again, in homeopathy, it's not the herb. It looks like those little pellets I showed you before. And it's very indicated when there is any movement of the tooth in the socket, especially after tooth extraction. And it has been shown traditionally that people often did not develop dry socket, that they actually didn't have as much pain following dental surgeries. And this is especially helpful whenever there are extractions of teeth. Traumeel is a very special complex homeopathic formulation. Typically, we want to really match the remedy to the person with a specific remedy, because the homeopathic remedy that gives the picture needs to be very clear and not confusing. So the remedy gives the picture, and the dilution gives the focus, makes it clear, not blurry, to the innate force in the body. And more is not better, and definitely not in homeopathy, because whenever you have an input to the body needs to do something with it. And the more input it has that is not, that is distracting, it won't work, or it won't work as well. Or sometimes it might create a situation where it needs to be, corrected at a very deep level. So we always want to give a clear picture. Now, this formulation is very special in the way it is formulated. You would never go out and take all those separate remedies that are in there and just put them together and think it works the same way. It's the manufacturing process in making that remedy that also has an impact of why it works the way it works. And it's an excellent remedy that has been used for 85 years, widely used in Germany after surgeries, and it really helps with soft tissue recovery. It shortens the inflammatory process, and it's a wonderful remedy that is having a very safe and non-confusing profile. Another thing homeopathy can do is help the body remineralize and put minerals where they're supposed to be in a faster way. So there are tissue salts, also called cell salt remedies, and these particular two are very, very helpful in helping the body remineralize bone and teeth, and also in general the oral tissues. And that's something to keep in mind whenever we use supplements or minerals in its original form. It's not just about what you're taking, but also can the body absorb it and do with it exactly what it needs to do. And this brings us later on to the supplement situation. But first, we want to see about dental anxiety, because it is something that a lot of people feel before they have a procedure. And in terms of homeopathy, it has to be a really individualized selection, especially if it's something that is a pattern for you and has been happening many times or in different situations. Because in order for the remedy to work for you, there has to be also an emphasis on not just physically, but also how mentally and emotionally that person is feeling. And some remedies, self-healing really wants to go and self-heal. It doesn't know, oh, you have a surgery coming up in 2 days. So with deep acting remedies that work on the emotional and mental level a lot, especially when it comes to anxiety, you do not want to have a situation where by accident you stimulate that old traumas or things that then all of a sudden you have to deal with before you go to have surgery. So it's always advisable in homeopathy to work with a qualified practitioner, because there's a whole order of how to use those remedies in which order. And some remedies don't follow each other. So, however, there is a remedy that I think would be great to have in every home pharmacy. It's called Rescue Remedy, and it has 5 different flower essences. It's not homeopathy, but it's the same idea of having an energetic information that is imprinted on the water and it doesn't have any molecules, but this imprinted information. And this is excellent to use when you feel anxious about something, or let's say you are the dentist and you get some bad news, something you didn't expect. You can use that to take that shock out of your system in that moment to help better process what is happening. And so for a few nutritional considerations, I know this has been covered in the prior presentations, but those are just some areas to really pay attention to. One is proper hydration. And this is not just after surgery, but also before, and especially for people who feel anxious sometimes before going there, being properly hydrated actually will make you stronger also, not just physically, but emotionally and mentally. So when we think about nutrition, it's not just about having all those nutrients. Oxygen and hydration are key nutrients, and we should always remember that. Of course, then also supporting tissue regeneration with building blocks that the body then can use, and nutrient-dense foods. Often after surgery, people are using blended foods because that is easy, and we can actually make sure we have nutrient-dense foods blended in them, like chlorella, that has a lot of good protein-building free amino acids and minerals, and other factors that make you strong, make your vitality strong. One note though for chlorella, if you're somebody that is dealing with heavy metal issues, that can sometimes be contraindicated for chlorella. And also the microbiome, having appropriate probiotics. Probiotics are incredible if it's the right strains that are missing, because they have an effect on your mental, on your immune system. And this is very, very important. And of course, the optimal vitamin D level. And there's an interplay of minerals and vitamin D in the body. So it is very good to take a synergistic approach, a very individualized approach to those nutrients. And when it comes to bone health, it's not just vitamin D and K2. There are other minerals that play a key role in making sure the body can absorb and remineralize, like boron and other like trace minerals. So those are some really key concepts to consider when thinking about how to support after surgery to help rebuild your body. And I really appreciate you joining me. And if you have any questions as we go into Q&A, I'll be happy to answer them. And I love to hear from you. Thank you.
Thank you so much, Jeannette. This was very helpful and very important. And the way we created today's webinar was intentionally starting with more of the medical procedures, the examination, the latest technologies we're using in our practice, and then transitioning to how can you supplement yourself and not only live a healthy life, but also specifically in the context of our practice to have better results with your procedures and long-term success with health in the oral cavity. And then Dr. Herman talked about a few options to tap into the body's own ability to heal. Our body's an incredible machine. I forgot who said that here in the forum, but it's an incredible machine that we're probably tapping into a very small percentage in terms of what we do in medicine. And then Jeannette talked about homeopathy, and I feel like getting that perspective from medical and dental professionals, plus a more integrative and holistic approach, makes our team very powerful, where we are well-versed in the technologies and the techniques that can help with dental disease and dental problems that affect your whole body, and tackling it from different perspectives, which makes us, again, just giving you a more integrative, full-scope treatment. And we want you to be healthy and keep being healthy. So at this point, thank you everybody for attending and for great presentations. Do you have a recommendation for a toothbrush?
Well, what I would definitely recommend is I find that the Sonicare or the Oral-B, or there's a lot of different brands out there right now, are a good adjunct to helping people get areas clean that maybe a manual toothbrush might not work with. Definitely after a surgery, I recommend a manual toothbrush because then a patient can be a little more accurate with what they're doing, and they sometimes don't get carried away as much in certain areas. So especially in the surgical site. So I believe that the electric toothbrushes really do an amazing job and really help people get a healthier mouth.
Thank you, very clear. Another question here. I started using a natural toothpaste and I noticed my bottom right teeth are very sensitive now when I brush. I can't go over that section, meaning these teeth, and those teeth get irritated when I chew on anything with a lot of sugar in that region. Why is that? So Dr. Rosenblatt, if you want to talk about your experience, your decades of experience in the different toothpastes, specifically holistic, what's good, what's bad?
I would just say in summary that just because some toothpaste are claiming to be natural, sorry, Jeannette, some of them claim to be without any medication in there, like fluorides or whatever, doesn't mean that they're just better. And unfortunately, there's been a trend many years ago to include substance like baking soda in the toothpaste. And unfortunately, that particular substance is very abrasive. So yes, it may take your tea stain or your smoking stain away, but at the same time, it will take away part of your healthy tooth structure, which will make the tooth more sensitive and maybe even more abrasive to your gums. So my recommendations are that you should use the toothpaste that have been approved by the American Dental Association because they have been proven scientifically with research over many thousands of patients that they are beneficial and they will do no harm. And lastly, I would just say everybody is individual. And I agree with Lloyd that the invention of the electric toothbrushes, and many of them are great, but just because it's $100, it's sometimes not better than a $1 toothbrush. So everybody should have not be afraid to ask their hygienist to actually show them, because many patients have not been exposed to 5 minutes of a lecture to be shown really what's the right brushing techniques and not over brushing, and how to brush effectively either with an electric toothbrush or a hand brush. But stay away from any unproven toothpaste that might have substance there that make your teeth whiter or take the stain away, but they have a lot of harmful products that will make your teeth also more sensitive.
Thank you, Ari. Very helpful. And you all are getting here a lot of 5 stars and thumbs up emojis. So great presentation. Thank you. Thank you for the feedback, Richard. A question for Jeannette. Jeannette, have you found any energetic implications for going under full anesthesia?
Yes, that is a very good question, because we are not just the body, we are the body, mind, and our soul. And anesthesia, some people do have ill effects after it, and there are things in homeopathy that can help with this, like phosphorus, for example. It's very important to sometimes take this shock out of people if that's what happened. With local anesthesia, sometimes it's not an issue, but when it's a full general anesthesia, it might be really, really important to help the body process that.
Thank you. Very helpful. So here's a question from Anthony. Thank you. My question is about gastric reflux or acid reflux. How can periodontists help us manage the mayhem that reflux causes in the mouth? P.S. Thanks for a safe and painless tooth extraction. You're welcome. So I'm going to answer that, and then I'm happy to pass it on to Lloyd and Ari. Well, acid reflux, besides it being very uncomfortable and actually painful for the ones that had it, it has devastating dental side effects. So the reflux and the acidity in the mouth can cause some of the worst cavities you'll ever imagine over time as the teeth bathe in acid. And that simply ruins teeth. And then you just need a lot of dental work, and sometimes teeth are not even salvageable. So, we are not in a position to offer remedies for acid reflux, but we all know the basics. Okay, the fried food, the quantity of the food, the timing of our nutrition before bedtime, and we need to see a medical professional, specifically a GI doctor, to manage that. But from a dental perspective, very often we would be the first ones to diagnose it, because many patients have subclinical acid reflux. So they don't have the symptoms, but they have that low pH, that acidic pH in the mouth, and we start to see erosions. So remember that word. The word erosion means that some structure has been taken off from something that is very hard, like a tooth structure. And it doesn't happen over one day or a week, but within a few weeks or a few months, you would start seeing those erosions close to the gum, and also in areas where we typically don't develop cavities. So if your dentist is telling you, this cavity, there was nothing there, but 3 months later, it's a huge cavity, or that's a very unusual cavity. So I want you to have like a little red alert that you might be having acid reflux. And a lot of our patients that we actually refer to a GI doctor are proven to have reflux, and there's treatment for that. We don't have to get into the essence of it, but a lot of it has to do with lifestyle, nutrition, and sometimes it needs to be treated pharmacologically. Dr. Herman, do you have any comments about reflux? Because it's a very common issue amongst our patients and people in general.
I guess one of the comments is probably trying to have the head a little bit above the stomach, so that you're not having as likelihood of that the acid coming up from the stomach up to the teeth. So that's one possible thing.
Excellent. Are any comments about acid reflux? I mean, I think every human being at some point in their life, felt heartburn, felt like they shouldn't have eaten that food at a certain point in time, and we know how uncomfortable it is. Imagine you having this on daily basis, and then your teeth go kaput. And what is your advice to patients that have this type of problem?
As both of you said, it's a medical problem, but it affects, unfortunately, us diagnosing it. And the only advice that we can give patients is get medical advice, get medical treatment. But if you're aware about having dental acid, it's very important, as Jeannette mentioned it, hydrate and rinse as many times as you can. And it's very, very important for those patients who have acid reflux is to make sure that they have very good hygiene habits, and flossing and brushing and using all protective measurements like applying fluoride on the teeth in order to try to have some remineralization happening. So have your water bottle next to you, and don't forget your toothbrush. And that's, I think, the only thing that we can help reduce the effect of it.
Thank you. Great advice. Question for Jeannette. When do you suggest to take homeopathy or homeopathic remedies? Can I take it with food?
Mm. That's a very important question. So because homeopathy gives a picture, it's not taking the food, but away from food or drink or water. So to not, to make that picture that is shown to the body very clear. So ideally, you're going to have it either like 20 minutes before food or an hour after food. If there's an emergency happening, homeopathy, of course, that goes out of the window. But if you can plan this like with a surgery recovery program like you have here, this is the best way. And you also don't want to touch the remedies with metal or with your fingers. You would just want to dispense them right out of the bottle as they come, or use plastic or wooden spoon. And one more thing that is important to remember, homeopathic remedies should be stored properly because it's about information. You want to store them away from strong essential oils like peppermint or eucalyptus, camphor, because they can override the information of the remedy and render it inert. So those are just a few important things of how to take care of this beautiful little globally that are helping your system. No? Thank you.
Thank you, Jeannette. So a nice comment here from Dr. Barry Wagner. Thank you for this presentation. 5 stars. Thank you, Barry. Great to have you. Barry's my father-in-law. Okay. Do you recommend dipping a dental pick in black seed oil to floss to help tame the bad bacteria in the gums?
I mean, a lot of people do oil pulling with coconut oil, and which has antimicrobial properties to it. So if this does have antimicrobial properties, then I see no harm in doing that, and it probably helps to get the pick through there better, and even make it maybe a little harder for the plaque to stick on the tooth. So that's what I would say is, if it's working, then hey, then it's great.
Great. Jeannette, let's hear from you.
Yeah, black seed oil has been used in Europe quite a bit to help with receding gums or any gum issues, and just by rubbing the oil on the gums. I guess the question is more about how do you get it in between the teeth?
Great. So this is the remedy. Sounds like it has some dental advantages and some from the more holistic approach. And from our perspective as periodontists, we're looking at 2 aspects. First of all, we want to mechanically remove bacteria. Of course, within 30 seconds, those bacteria will reestablish their biofilm, because that's how bacteria organize on structures in general, but specifically in the mouth. And so that, there are different ways to do that. And second, there is also we call it chemotherapeutic. It's not in the negative sense from cancer treatment, but there are certain substances and certain rinses that can also help and work on that level against certain bacteria. But please remember that our goal in dentistry is not to eliminate bacteria and not to eliminate all the fungi and viruses in the mouth. If we do that, we're going to get parasites, and we're going to get worse. So remember that part of the human body is to have microorganisms. We actually would not be able to thrive. And a quick fun fact is that in the breast milk, there is 40% of the breast milk cannot be digested by a baby. So why is it there? It's there because it's feeding the baby's microbiome. That interrelationship is that significant, so the human body created that feeding mechanism, not just for the baby, 60%, but 40% goes to the microbiome. And here's your proof. So we don't want to get rid of all of the bacteria and all the microorganisms. We just want to make sure that they're balanced and they live in harmony. And if they don't, call a dental professional. A question from Xavier. Hi, Xavier. Good to see you here. Great presentation. Thanks. How do you best incorporate water picks in addition to brushing into your daily routine? Dr. Rosenblatt, I'm going to give this one to you. Water picks.
It's one of my favorite subjects because water picks are easy to use, and we see on television the advertisement of all those molecules flying around, and it looks like very effective. And in some cases, it is. But I emphasize to my patients that when you hose down the floor and it looks clean, and then you take your finger and wipe it, there is a microfilm still present. And so my emphasis to my patients is that for people who have spaces, for people who have the need to use the water pick, there's nothing wrong with it, but you will not remove the microfilm on the tooth unless you physically brush and floss and use the water pick either before or afterwards. So it's a great tool, but it doesn't substitute for flossing and brushing.
Thank you, Ari. Very helpful. A question from Jeff. How do you feel about Listerine, assuming not great? What mouthwashes, rinses do you recommend using morning and night? I'm just going to relate to the first part of the question. How do you feel about Listerine? I feel okay about Listerine. The only problem with Listerine that I can see from just a compliance point of view, it's very spicy. It kind of burns a tiny bit from, so if that's what is the issue, you can always dilute it. But in essence, most of the research, most of the studies have shown that Listerine is a very good rinse to reduce gingivitis and soft tissue inflammation. Does it have some ingredients we don't love? Yes, it does. It has alcohol. It has other flavoring components that are probably not the best for you. Dr. Lloyd, would you talk about the second part of the question? What rinses, mouthwashes do you recommend using morning and night?
Well, one of the ones that we use in our office is Closis. It's not as holistic as some, but it definitely has no alcohol in it, which is one of the issues with with some of the things like Listerine, but there's also Listerine without any alcohol in it. Whether or not the alcohol has an effect on your mouth, being maybe you're rinsing for up to a minute or something, I don't know. I think that the conclusions on that are still out. There are other rinses that are in the pharmacy, and I guess you have to look at the ingredients, look at what how it's making your mouth feel, and kind of do an experiment, because some of them might have some really good components to them, and they can help you a lot. There's also a post-surgical kit, Stella Life, and that has a lot of homeopaths in it, and so that's actually a nice kit, but that's probably not for everyday use. That's very good for post-surgical use.
Excellent. Thank you, Dr. Herman. And I hope this was helpful to Jeff. Jeff took the time during his vacation. Him and his wife, they're now in a cabin. At least this is how I imagine them. And they took the time to watch this webinar during vacation. So it was that important to them. So Jeff, it's great to have you as a patient. And thank you for trusting us for all these years. A nice comment here from Mirta. Thank you for a wonderful presentation. You're welcome. We're very happy it was beneficial to you. A question for Jeannette. Have you found that some surgeries can create opportunities for blockages to enter or to form?
So that's a very good question, because when we think about blockages or energetic blockages, really it's an information. So especially when I do my energetic work, and a blockage is a negative information that keeps attracting energy. So let's say during surgery, I mean, your team is amazing and extremely aware and conscious. It's beautiful to see. But let's say you have somebody doing a surgery that is talking all kind of things that are not very beneficial or positive, that can have an impact potentially because the body will receive and retain information. And that is one aspect. And the other aspect is that when the person is having a surgery, let's say there was information stored in this part of the body, it can put things in motion in the regard of an energetic pattern. So, but with homeopathy and with actually clearing things on an energetic hands-on healing, that's really the core of my method, really, because you want to make sure that those deep patterns, that information that got locked in, that they are being moved out, because then the self-healing power is the most capability to tap in all its resources and not be interfered at this level.
Thank you for explaining this. Even as a dental and medical professional or professionals here, with being trained in a medical school and in a dental school and in residency, the amount of knowledge being taught is in the holistic world and some Eastern medicine is not enough. So this is why we felt it was very important for us to offer comprehensive care for a lot of our patients. So thank you for participating. Jeannette, was there anything else you wanted to share? We've interacted for the past more or less 2-3 months. We have several patients that have seen you with complementary care that is homeopathic, together with the more conventional surgical care in our office. Was there anything you wanted to share about that type of interaction and that type of or the benefits of combining both homeopathy and conventional care?
Well, when we help the self-healing power, when we help the body's innate mechanisms of self-healing, it makes the process of recovery faster and also often less painful, as we can see from experience, because the body has the ability to handle what it is, what it needs to deal with in a much more efficient way. And it's amazing to see how self-healing works. It's humbling to see what's possible, because anybody that is alive, you are a miracle for existing, because life is flowing through you. Life is always rooting for you, no matter what the situation is. And having that resource available together with the care that your team, that's the periodontist team is giving, they're artists in their own right, doing surgery and fixing it beautifully. But in the end, it is your body's own innate healing ability that will make sure it heals without complications, and it's strong, and it builds up its reserve energy again and handles the situation without creating a trauma that is stuck in the body and keeps interfering. So working together complementary enables us that this process won't create an interference field in the body that then creates other things down the road, because it's those interferences that keep the own innate force from doing effective work, because the body's wisdom is incredible. The body knows exactly what to do in what order. But in order for that to happen, it can't have tons of interferences. So we don't want an event like a surgery create interferences in the physical and the emotional and the mental. And by working closely during that stage, there's a much better chance that the body just then can be free from additional interferences.
Thank you so much. Excellent. Dr. Herman, from your perspective, after over 30 years of practice, you practice both conventional dentistry, at a very high level, in Aspen, Colorado. I mean, you had a successful practice there. Now you have a successful career as a periodontist. What things can you recommend to patients about their oral care, benefiting from both the holistic and let's call it just the conventional, not in a bad way, just the conventional medical and dental?
So probably my biggest advice to people is, first of all, take your oral health seriously from a young age, because basically you can't usually reverse a lot of the things that are done when you're young. So really, it's important to stay on regular cleaning, schedules and keeping, good hygiene program going with, and learn actually how to take care of your teeth, flossing and brushing and any other adjuncts that might help you to get your oral health care done and taken care of. And so one of the things that also I think is a big contributor to our oral healthcare being out of balance, or our oral environment being out of balance, is stress. I think stress is one of the biggest things that people underestimate. I've had patients where they've told me, oh yeah, that's when I got the recession, when I was really stressed for a few years. It hasn't progressed since. So really, you need to have some balance in your life. And I really love what Jeannette brought forth to our energy systems in our body are real important to take care of. And we underestimate it in the West. We're not really brought into that realm. I think we're more like, if you can't see it, can't believe it. So I think that's important. And then it's so great that Ari brought forth a lot of the vitamin supplements. I think that's important to make sure that you're not nutritionally deficient. I did an extraction on someone recently, and I was wondering why it wasn't healing. And ends up they go for a blood test and they're deficient in a lot of their vitamin D and all those things. So really their body was out of balance. So really taking all this advice and using it all to make your oral health an important priority.
Thank you. Thank you, Dr. Herman. And it's great to have you on board. And before we go to Ari, I just want to read a couple of comments here. Sandy actually commented. Sandy, it's great to hear from you. This is what Sandy's saying. Great information. So happy you are my dentist. And we're happy that you are a patient and you're awesome. So thank you for trusting us for many, many years. And we are here for you. From Tanya, thank you for a wonderful presentation and taking such good care for our teeth and mouth. And now we know that the teeth and the mouth are connected to the whole body. I think we made it very clear amongst us four. Now, Dr. Rosenblatt, from your perspective, has been with somebody who's been practicing, for 43 years. You are the founder of Periodontal and Implant Specialists of Beverly Hills. I mean, you've seen empires rise and fall. You've seen it all since the beginning. How would you summarize in a few sentences how things have changed from when you started back in the 70s, back as an immigrant fresh off the boat, and until where you're at today after over 4 decades?
Basically, since you summarized and made me old by seeing how many years I've worked, I always remember what my teacher at the university said, that what we learn in our profession, especially in dentistry, like every 6-7 years, 80% that we are using now has not been taught in dental schools, that we have to be on our toes and continue to educate ourselves. And I pride myself to have a great partner like you, who we together elevated our practice and never sat back and just relied on our old wisdom, but wisdom can be improved. So that's why we are continuously going to seminars, continuously giving lectures and learning new things. And since everybody shouted out thank you for the seminar, I have to thank you, Ziv, for making the effort of educating our patient, introducing me and our patient to the Zoom lectures. I think it's great to share our knowledge, and we can assure all our patients that I am so proud to have this great team together with you and Lloyd. And to all our patients, we appreciate your loyalty, we appreciate your trust. But be assured that even if it's 5 o'clock and the office phone goes to the answering service, we keep educating ourselves. We are not sitting back on our old laurels. And that's the only way we know to practice in order to improve our lives, that we love being in practice and helping our patients.
Thank you. Words from our founder and a great friend for 21 years. And I know I'm always busy and I might seem like I'm, always running, but you're a true friend, Ari. And Lloyd, you're a true new friend. So that's good. And Jeannette, you're a friend as well. So this concludes Periodont Tips, advice from your periodontists and a wellness expert. And we hope you enjoyed it. We hope it benefited you. And we hope you learned one or two things that can improve your health and well-being, your mindset, and just happiness in life. Because if you're not healthy, it's hard to be happy. So we hope we played a small part in contributing to that. If you found this webinar helpful, feel free to share it with other, friends and family that might benefit from it. We will have more webinars like we've done in the past, and we might tackle different aspects of health because this is in our core of our mission here to serve you, get you into a better condition, a better state compared to how you came in, even a little bit or much if possible. And as always, we appreciate your trust and we wish you all well. So on that note, thank you, everybody. Have a nice night. Stay healthy and safe. Take care. Bye, everybody. Take care.